This is Dr. Song. Welcome to another edition of our updates from the front line. And I'm going to start today by introducing you to a very good friend of mine, New Jersey attorney Victor Herlinsky. Victor has been very active in both New Jersey and national politics. And I brought on Victor tonight because I wanted to speak with him about what it's going to look like to open our economy back up. So we have, I know there's been a lot of talk recently in national and local politics about getting this economy restarted, because as a small business owner myself, we've been closed for going over a month now, and everybody's itching to get back to work and get this economy started. So Victor is very involved in politics, and he hopefully can give us some answers on what the politicians are thinking, because I can share with you some ideas of what I think should happen about how we should go about our economy. So welcome, Victor, and I guess I'm going to just start with asking you a few questions. I guess just to begin with, when do you think that Governor Murphy is going to open up the New Jersey economy, Victor? Do you have any thoughts on that?
Well, look, and I want to thank you for the opportunity of appearing here tonight, Dr. Song. I've known you for a long time. I very much appreciate the stuff you're doing on the front line, particularly with patients. You know, it's easy for me to do what I do, giving people, but I do it by the safety of over the phone. You don't have that luxury, and I really admire what you've been doing. As far as dealing with the reopening of the market, so to speak, or of the economy, it's not going to happen at one day. It's not going to be like, I know when I left the city of Newark, which I've lived with my wife for the last several years, and came to our lake house in upstate New York, to quarantine ourselves and stay away from harm's way. I always had in the back of my mind that this was going to be a 2-month process. I used June 1st as a deadline of, when things were going to be back to normal. We're not facing that. We don't have the testing in this country that, or the contact tracing that are necessary, that have allowed economies such as Germany and Italy and China to come back online. We're still not addressing those issues in the numbers that a nation of 330 million people are going to be able to face. So the short answer is, I don't know. The longer answer is that it's going to come in waves. I would predict, and I'm not guessing, I would predict that you're going to see the governor start to ease some of the restrictions that have been put in place. We're really in total shutdown right now. I know the city of Newark has a curfew and has the literally you cannot walk the streets at night or during the day. Mondays, you're not allowed to operate even essential businesses. They call it Be Still Monday. You're going to see that starting to ease, I would say perhaps as early as May 1st, but that's going to be in certain sectors. For instance, right now they've shut down all but extremely critical or public projects, construction. So construction, you're going to see the restrictions ease up as long as they can provide for proper social distancing. And doctors like yourself are going to have to guide us as to what proper social distancing is. Now, you're going to see other businesses start to be allowed to open. I don't think you're going to see restaurants open for quite a while. I don't think you're going to see sporting events open for quite a while. That might be something that extends even to the fall. I think what they're going to do is start to open up, and as long as, for instance, if they open up construction on residential buildings, as long as you don't see an uptick in the hospitalization, they seem to have flattened the curve. As long as that continues, you're going to see them gradually open up. But I think they're going to keep pace with their hospital facilities, certainly the ventilators, and other things along that line.
And there's going to be a lag. So if we open up, let's say we open up restaurants, we're not going to see the hospitalizations increase that week. In fact, it'll take several weeks for us to even see the results of loosening up the social distancing. So is that the only thing that they're going to be measuring, or how else would they be able to tell if if opening up certain sectors is backfiring?
Well, I think what you're going to see, particularly with some of the people or the governors that have been the hardest hit, Governor Cuomo, certainly Governor Wolf in Pennsylvania, as well as Governor Murphy, I think what you're going to see them do is rely on the guidelines that are going to set either by the CDC or their own state agencies, the Department of Health here in New Jersey. As long as they're not going to do anything without having health professionals go forward. Now, there's other states, for instance, Florida, Georgia, Texas. You may see politics enter more into the decisions, and they're going to roll the dice and hope that their numbers don't go up. Understand that those areas haven't been as hard hit as the metropolitan area here in the tri-state area, but you're the doctor. You would tell us if, since it's already in this country, is it going to spread to those areas? And if they eliminate the social distancing protocols that have been put in, are they going to cause spikes in those regions and a retrenchment and a go back to the lockdown that we see today?
Yeah, I think what we're doing with the social distancing here in New York and the country, I think it's working. I think it's working phenomenally well because, I remember when Governor Cuomo was talking about needing 30,000 ventilators, and we didn't end up needing that. But I think it's only because everybody was listening and doing the social distancing. And, that's a tough thing to do, having to close your business, and lay off your employees and just unfair, because as a doctor, I can see what's happening. But for a typical business owner, being given the order to close your business at a time when you're not actually seeing, because people close their businesses before they actually started seeing people they know get sick, and that's a big leap of faith to trust in your officials, your governor, and then especially if you're getting from different lawmakers, choose who to believe. So I give a lot of credit to the nation to the degree that it has, and I think it really has made a huge impact. And I think that's why at this point, as much as I want to just get back to what we were doing and get back to normal per se, I think that this is something that's going to take a very close coordination between the government and businesses and the medical professionals to do this correctly. If we don't do it right, all the things that we've made for nothing, and we're going to have to do it over again. So
yeah, one thing I would just add to to moderate something of what you said, is that, you know, the real reason why ventilators have not been the issue that we initially thought they were is the survival rate of people on ventilators is so low. I think it's as low as 20%. So, you know, for instance, in my community here, we have 2 emergency room doctors. Fortunately, neither of them tested positive so far. But, you know, their ventilators, they're not having as many new admissions, and that's a direct result of the social distancing protocols that have been put in place. But the ventilators are unfortunately freeing up a lot more than you would have thought, because people are dying and not needing them anymore.
People are dying on the ventilators.
On the ventilators.
Yeah. That is we're seeing here. Now we're starting to see people. You know, I know at least one person that I know that died on, ventilator, and people down south or in other states, you know, are not really directly. So they're still, you know, having to take it on faith. But you know, we had the warning. 2 weeks before it started here, and they were warning us, and that's when I started to take it seriously, because they were talking about doctors were talking about having to pull a ventilator person and letting that person they were younger person, or trying to decide to whether to save somebody, you know, a younger person that has kids, or, you know, somebody else. So that kind of decision is something that a doctor would never want to make. And we were kind of spared that because we did not exceed the capacity of our ventilators. But what concerns me is that, you know, although we are starting to see the peak here, and actually in New Jersey, North Jersey, I think we are, you know, it's still going up slightly, but we're kind of at the peak now. But what's alarming is that the numbers are going up as we go down south, further south. So last night I was at the field hospital in Edison, which opened up 2 weeks ago, and they are starting to get increases in numbers, and it's basically overflow from the hospital. And they just opened up another field hospital in Atlantic City, and they think just got their first patient. But this is occurring. So if parts of the state maintain the social distance, then it's just going to come right back at us, because of course people are going to move. You know, people are gonna, from South Jersey, will come back up to North Jersey and infect more people. So it just seems to be a revolving door here. So I'm just wondering, you know, how the government is going to try to prevent that from happening. We're opening up in sectors. There. I'm just afraid it's going to work. You have any thoughts on that?
Well, look, what I think you're going to see, look, there's no protocol. We had a pandemic in 1918 that really took 3 years for the world to cycle through. We had some near misses, SARS, for instance, the Ebola crisis, but we were able to put in the protocols. And they were different viruses in the sense that, you know, anybody who watches Dr. Fauci on any of the morning shows will tell you that this virus is unique in how it's so efficiently transmitted from human to human. What I think they need to do now is, you know, they've locked down our economy, in a sense, the world economy, and as they open up, they need to be able to control further outbreaks of it. South Korea has done a very effective job through temperature gauges in every public place. They do contact tracing. Germany does that very well as well. If you have in Germany an instance where somebody has broken out, has been tested positive, you'll see the government send a health official there. They'll send a team. They'll interview the person. They'll find out all the people that have been in contact within a certain period of time, and they'll make sure all those people are tested so that if there is a potential for outbreak, that those people will be contacted, they'll be treated, and they will not be able to go beyond the circle that has been subjected to the virus. We don't have that. To do the kind of contact tracing that we see now in Germany, South Korea, Italy is starting that. We would need about 300,000 workers. I believe the latest I think we have in this country is 15,000. So we don't have the teams available to really open up our economy at this point. So that is, I think, what the next step of the government programs that you've seen. We're now through 4 CARES Act, the Corona Act that has been passed by Congress. I believe it passed the House today. It's going to the president's desk tomorrow, and I believe that will enable the 4th amount of stimulus. Now we have to get to the real idea of, besides subsidizing people that are shut down. For instance, your business, my law firm, everyone's working remotely. That's 150 lawyers plus all our support staff. Several hundred people that are now, not out of work, but certainly not working at their full efficiency. And we're lucky, we're able to work. But other people, for instance, where you have to have contact with people, you're not working. The restaurant industry is not working. The retail, brick and mortar industries are not working. So for us to be able to allow those businesses to operate, those industries to operate, they're going to need to have significant testing, and we're just not there yet.
Yeah, so I definitely agree with you on the testing. The other thing, kind of seeing that really making sense to me is the way that we're doing these the social distancing. For instance, why do we have to close? Beaches? Because people are outdoors and just kind of keeping a distance and not congregating. I mean, I think the chances of catching the virus from somebody in a park is very low, unless you're having a picnic and you're sharing food. And I think that's how the virus would get passed in that setting. So I think we have to look very granularly to these things. I mean, for instance, I went to get a pizza the other day, and I saw that the guy that was taking the money at the cashier was wearing a mask. All the customers were wearing a mask, but the guy in the back making the pizzas and the sandwiches didn't have a mask or gloves on, and he was way in the back. But I guess their thinking was the guy in the front was trying to protect himself from the customers. The guy in the back, I mean, I would eat the pizza, but I'm not going to eat a sandwich. Because the virus or any germs, get from his face to the deli meat or the bread. That's not going to get cooked. If I eat that, if he was sick or asymptomatic and sick. So those are the kind of things that we need to to really look at. And I think we're gonna need training. You know, I think food service workers, waiters, gym employees, they're all going to need some kind of training on infection control. And the general public as well is going to really need to take a crash course on infection control. And I think that's happening, but I think that's where we need to really put a lot more effort instead of just laws and saying we can't do this, we can't do that. I think if people have a better understanding of how they can protect themselves and each other, we can make some much faster progress. So I just wanted to, I'm going to open this up for questions from the audience. If anybody has any questions that they want to ask either one of us. But before I do that, did you have any final thoughts, Victor?
Well, the one thing I can tell you is that the world is going to change. You know, there's just the fact that, you know, my lifetime, I'm 54 years old, I've never had the world shut down. And right now the world is shut down. And it crosses borders, it crosses cultures, it crosses religions. It is something that, you know, everybody is on pause right now. You know, some of us are able to limp along and to do work, but nobody's at full capacity right now, whether you're essential business or otherwise. And in the post world, you'll probably see a lot more of remote working. Your brick and mortar offices, businesses are not going to be what they were. People have found a different way. I can tell you, the Zoom Easter dinner I had with my mom and our family all around the country was actually kind of enjoyable. You know, I didn't have to worry about traffic or schlepping into the city or parking my sister's apartment building in the city. I'm not saying I'm not going to see my sister again, but it's there's parts of it that are let's say more convenient, and I think everyone is a lot more technologically savvy than they were before. Government's challenge is to adapt to the post-corona world. This is probably one of the seminal events in our lifetime. And, you know, Dr. Song, I do have to commend you for getting on the front line. It can't be easy to walk into a hospital, no matter what you have as far as PPE equipment, to you know, make sure that you're protected. So, you know, that's my hat off to you. You're a braver man than I. That being said,
thank you. Actually, I think in some ways it's actually safer because you know that, you know, you have to protect yourself. It's when we're out in public where we don't know who's infected and who's not. You know, I think that's the scary part. So I'm gonna unmute people so that, you know, if anybody has questions or comments, I would love to have input from you guys. And, yeah, Beth, I think you look like you wanted to say something.
Yeah, this is Beth. I work with Dr. Song as the nurse in the office. And, you know, I've noticed the same thing, that people out in public really don't understand infection control. For instance, I had gone to my ShopRite even a few weeks ago when this was first starting up, and the person at the checkout was wearing gloves, and it was clear he probably wore those gloves all day. So once people wear gloves, they are, we're getting an echo. They have to understand that it's just like your hands touching something. And if you touch a glove that gets contaminated and then touch something else, you're contaminating whatever you touch. And his hands were sweaty. Like, they were clear gloves, they were sweaty under the gloves, and it was clear that all kinds of things were probably growing there because bacteria and viruses love moisture and warmth. And that's what frightens me, is that, you know, as a nurse, I know how to protect myself. I don't know if other people know how to protect themselves. How do you propose, Victor, that we are able to educate the country, because I see people wearing masks with it under their noses, putting their masks. They don't understand this. How can we educate our country so that people can protect themselves and others?
Well, look, the fact of the matter is, I don't think we'll be able to fully protect ourselves from living their lives. And you know, Dr. Song had made the analogy, had remarked about why close the parks, because people get attracted to parks and they see somebody they know and they think maybe this person's big. You know, all we have to do is see that the spring breakers did in Florida to know that if you put a place, a public park where people want to go, people by nature are social creatures and they're going to congregate. So if you eliminate that temptation, you're going to make it safer. You're never going to make it completely safe because people are going to do as they do. But if you control it to a point where we can get our testing up to what it needs to be, that we can put in the protocols for contact tracing, that you can, and certainly you can keep your hospital facilities at a level that they'll be able to deal with any spikes in the infection rates. Well, then you're going to have a process where you can take the risks of people going out there and not properly wearing their masks or reusing their gloves over and over again or any other things. You're never going to completely educate, 6 billion people that live in this world to take proper care. So that's what the government's going to do, is control the re-entry of all of us into the society that we knew pre-corona.
Are they going to be able to enforce it? I mean, it seems right now it's kind of an honor system. Everybody's just listening and doing it. But we do see some rebellion occurring around the country. And certainly if they start arresting people, then it's going to really, get people agitated. So how do we, we know this is working, but people are getting restless. We can certainly, we're not China, we're not an authoritarian state where we can just order everybody, So I guess that's the tricky part, because we have to rely on people kind of trusting our government and our medical professionals and going along with what we're advising them. I think we start trying to impose this by force, it's going to, create a lot of, I hate to imagine what kind of disruption it's going to cause, because we're already starting to see some of these conspiracy theories really take hold, So it's a very interesting time to see how this unfolds, to see if this is something that, really, something like this should bring the world together. This is something that every human being, on this planet right now is feeling the impact of it in one way or another. There are very few places in the world where people aren't feeling the impact of it. And I would think that this would bring us together, to find a solution, to help each other. But unfortunately, we see opposite things happening as well. It's very interesting. Does anybody else have any input or comments, anything that they've noticed happening when you're out there? I've talked to some people who haven't left their house in a month. They're getting fresh direct deliveries to their house, and they haven't left the house.
Guilty as charged.
Yeah, I'd like to mention, This is Jane. I have been in since March 13th. I had about 3 visits to Trader Joe's. You know, trying to do that every 2 weeks with caution. The mask, the gloves, and they're really good there about, you know, limiting people in. But, you know, it's a whole process. It's time consuming, wiping stuff down, you know, wiping everything, getting my clothes off to put clean clothes on. It's like a whole ritual that takes an extra hour. But I could deal with that if it's only like 2 weeks. My paranoia is I've done my share. And when a ban is lifted where we could go back to somewhat of a normal life, now I'm mixed in with a bunch of people who haven't done their share.
Yeah. Yeah.
So that's my paranoia. Like, what, you know, do I pick and choose where I'm going to be?
Yeah, that's a challenge, right? You know, when I think about the pizza place that I talked about, I mean, that's a place that, you know, that I like to go to, and, you know, I like the people there. I don't want their, you know, I want their business to succeed. So, you know, I was kind of, you know, torn whether I should say something to them. You know, I probably will at some point, but then, you know, it's awkward, you know, because they may see it as you know, accusing them or something. But I think that's gonna have to start happening, where we have to kind of, you know, police each other in a way, just kind of do a little shaming for people who aren't taking it seriously, because the alternative is to have law enforcement do it, which would, you know, make it much worse.
Look, that's what we're doing right now. And it was interesting. There was a poll that came out today, really applauding Governor Murphy on his response. The only part of the COVID response that was even remotely controversial was the public shaming he does of people that have been accused of violating the lockdown order.
What do you guys think about that, the public shaming? I know we've, you know, had public shaming for a lot of different things, and, you know, there's been a backlash against that. But, you know, this is a situation where, you know, it is life and death. You know, if somebody is kind of disregarding what everyone else is trying to do, you know, should we shame them into stopping?
Well, you know what? I see it as more of, it's like a parenting thing. If you shame a kid in front of everyone, they're not really going to learn. They're going to hate what is done to them. I think you need to not shame them, and I think they need to be taken aside and told, you know, this is what you need to do. But if you shame someone, they're not going to learn. All they're going to know is, oh my gosh, I'm so embarrassed and I hate you for shaming me. They're not going to change the behavior. I mean, I understand the point of public shaming, but I don't think it's constructive.
Good point.
About kids, I have an input about kids from thinking. So my family has been locked down for like about probably 5-6 weeks now. We're very obedient. Even the adults, none of us has stepped out of the house. I'm observing because I clean the groceries order from outside very frequently. So I assume inside of the house we don't have to follow any like new rule. We live the same way. So I'm worried if one day the kids go back to school, they don't know how to wash their hands for 20 seconds. So sometimes if I remember, I'll try to tell them, oh, do you know, you need to do this. So I wonder if school can educate the kids and then they can turn around and educate their parents to tell them, because it's easier to organize them and teach them new things. The adults I'm from China, by the way, we're told not to, like when you walk along a staircase, don't go down to the railing because it's dirty. Like don't sit on the floor because it's dirty. So we're more aware of that, being from a country that, you know, we have to rely more on, you know, your self sanitation, not just the healthcare to save you. So in this country, I think it's a habit. It's a probably 200-year-long habit of trusting and you know, not follow those self-protective you know, mask or all these cleaning. But I think kids might be a good angle to you know, get this idea through.
I like that idea. Get the kids to train their parents. That's a great idea.
It's actually been used before with children learning about smoking being such you know, an important risk factor for health. And I think there might be a lot of value in doing that. I do think we need to make health education more sexy so that people are interested in it and, you know, find, you know, motivation to follow these, you know, these new procedures that we all need to know. And, you know, it's interesting. I saw a meme on Facebook. It's a Venn diagram, which is 3 circles that overlap. And, you know, people are saying it is possible for people to take the COVID-19 seriously and also worry about, you know, be concerned about the government intruding upon their lives, because that's a concern here in America because we're so accustomed to our freedom. And then people concerned about our economic situation. But what concerns me is that we're seeing people protesting in some of the states where they feel that the restrictions have been gone too far, but they're not wearing masks. They're standing right next to each other. They're having conversations shoulder to shoulder. So that is in conflict with what I'm seeing here, that, you know, people say, oh, I can be concerned about all of these things. So I'm just, you know, curious about how we all of this to help people feel that they do control their own lives. And part of that is health, but also navigating through our economic recovery. I'm wondering, Victor, what you think about that.
Look, it's a balance that we don't know how to do yet. You know, we have, you know, our initial response again wasn't a response of other countries in the sense that we kind of minimized it. You know, we probably missed nipping the dynamic of what we've seen, which is the world's most cases. I mean, more cases are here than any place else in the world. And one of the reasons for that is that, you know, when we initially were struck by the onset of this pandemic, you know, we spent several weeks kind of avoiding the issue. And, you know, we're in the middle of it. You know, here in New Jersey, I believe we lost almost 400 people in the last 24 hours, you know, which is significant. And if you look at the population that it's attacking, you know, it's the vulnerable, it's the elderly, it's the people that have had problems up to this point. You know, we're losing people on a daily basis, and yet, you know, here we are saying, well, when are we coming out of it? And the truth is, the science, we'll come out of it when we have a vaccine, but we can't wait the year to 18 months that a vaccine normally takes.
Well, if we're fortunate enough, I'm sorry, I didn't mean to interrupt.
Yeah.
I was just going to say, if
No,
we're fortunate enough to have a vaccine developed. We have HIV, there's no vaccine.
Correct. But at least we have, in that case, a method to treat it. You know, I remember talking to Dr. Song about hydrochlorine, which, you know, everybody was saying was going to be the miracle drug, and now it doesn't seem to be doing that, and you don't hear people talking about it like they did even a week ago. So the idea of what the government needs to do in this case is probably throw as much money as they can into the research, the testing, again, the contact tracing, so that if there's, I'll give you for instance, if you go to South Korea right now, all the restaurants are open. Because before you go into a restaurant, they literally have somebody taking your temperature. If you have an elevated temperature, there's literally a health squad that is goes to that spot, takes you to the nearest facility to get you. There's testing for everyone that wants there. You know, they do more with their population, which is about 1/8 of ours, than they do more testing than we do for our entire country, and that's again with 1/8 of their population. They're able to, you know, limit the outbreaks because they're on top of it and they don't let it spread. We don't have that. We're shooting blind, and you know, if you're symptomatic today, you can get a test. If you're not symptomatic but you've been exposed to somebody, you can't get a test. One of my law partners has had it for 3 weeks. He was tested. He came positive. He's had fevers literally for 21 days, and he's close to 70, so he's concerned. But I can tell you this: his wife can't get a test. His daughter can't get a test because they're not symptomatic, and just having contact with somebody literally in their home isn't enough justification for the limited testing abilities that we have here in the state of New Jersey.
And that flies in the face of testing contacts, and the fact that, you know, we heard that everybody who wanted a test could get a test. But another thing I'd like to ask you is, you know, we used to have what I think it was called the CCC, the Civilian Conservation Corps. I think that's what it stood for way back when. And hired people after the Depression, I believe, who were, you know, out of work and needed a way to support their families, to make an income and so on. And I'm wondering if something like that would be useful here now to help us with tracing and contacts and giving people meaningful work that would help us get control of this.
Oh, look, that's a fantastic idea. And quite frankly, I haven't heard of it before, and I think that it's something that people should look at. We need 300,000 people.
A lot of people.
To staff the protocols for contact tracing in this country. And again, right now, I believe we have 15,000.
So at least for New Jersey, New York, and Connecticut, former Mayor Mike Bloomberg just announced that he's going to head a task force to ramp up the testing for us. So that's good news. And then we can show the rest of the country how that can be done. So yeah, we're here, you know, in New Jersey, New York, the hot spot right now, and I mean, it is very real to us. And what's frustrating is that people in other parts of the country don't really believe, you know, that this is real or serious. And I can't really blame them, because we were the same way when this was happening in other countries. But the bottom line is we got to get this, you know, we got to get this economy going again. We have to open up businesses, but we got to do it in a way that's safe, that people aren't going to get sick or die. And I guess what's really different about this versus other flus and things that are going around is because it does actually affect younger people as well. You know, I mean, some of the people that are dying are young parents of young kids, and everybody has underlying conditions. So it is kind of the randomness of it. You know, if there's, you know, I mean, people are dying from opiate abuse and vaping, and these are terrible things because they're taking young people. But at least people feel like they have control. You know, if you don't use the opiates, or if you don't vape, then you know that you're not going to die from that. But this, like, you could be doing everything that you can possibly think of to avoid getting it. And a lot of it is going to depend on the behavior of other people around you. So I think that's what makes it so different. So it is a challenge for us to come up with solutions where we can get society going again and be able to interact with each other in a safe way, so we're not killing each other. And I think that is the challenge for all of us. You know, I hope that we can, come up with solutions together without the country fighting, amongst each other. And, that's not going to be productive at all. So, Victor Herlinsky, I thank you so much for joining us.
My pleasure.
Yeah, I mean, this is a conversation we'll continue to have, and maybe sometime in the near future, when we do have some good solution, we can get back on and tell people some good news.
I like Beth's solution as far as having a CCC. I think that's an excellent idea.
Thank you. And just to tell you, if you don't mind, I just got a text from my daughter, whose friend from college, who's also an art teacher, as she is, has a father who is probably late 60s, living in a nursing home for the past 2 years. She just texted me that he has COVID. So it's real.
Oh, no.
It's affecting us. And, all of us know somebody who has had this. And my daughter is this grief for her friend as we all sit here.
Okay. Let's do a lot of praying, and hopefully we'll come out of this on the other side.
We will. Thank you again. And for those of you watching, I do have some other videos that you can watch if you want to get some more tips and information on social distancing, infection control, and following up on this pandemic in general. You can go to wipecovid.com, WIPECOVID.com. And you can watch some of the other videos. And thank you again for joining us. And we'll keep the information coming. And I'll continue to update you on what's happening here in New Jersey. Thank you again, and good night.
Thank you.
Good night.
Yeah.